Hello everyone, Dr. Smith, physical therapist here. I really didn't think that I was going to have to make a third video on poor infection control, public health violations, and ethical violations in outpatient physical therapy, but that time has come. Now, if you are an outpatient owner or therapist doing the right thing, acting ethically, protecting yourself, protecting your staff, protecting your patients, thank you so much for setting an excellent example and leading by example. Now, if you're not doing this, I want you to consider why every other therapist in every other setting is wearing a mask when they're treating patients. And most of the time, their patients are wearing a mask as well. Look at home health, acute, sniff. Yes, this is Medicare Part A, but if you're seeing Medicare Part B, these patients are at risk as much as those in Medicare Part A, just based on age, comorbidities, and so on. And usually after they come out of Part A, they go to Part B, so they can go and see you, and you not protecting them is doing a disservice to your patients. Next thing I'm going to talk about is you, your staff, or one of your patients has tested positive for COVID, but you don't want to tell anybody about it. If you actually look at your state laws, look at the public health laws, if you know somebody has a communicable disease and you don't report it to the board and they've been in your location where other people can catch it, you can actually get a 2nd to 4th degree misdemeanor that can also result in jail time, fines, and loss of licensure for being negligent. Now, for reporting this, contact your Board of Public Health or your Board of Health, and I'm going to say this because I have to say it, is calling somebody on the phone and them telling you that what you're doing is okay by not reporting it will not hold up in court. Will not hold up when your license goes to the board for review for being negligent. Now, I understand that you don't want to be known as the clinic that has COVID, but at the same time, not disclosing it to patients, not disclosing it to the state health board is actually going to be way worse for you in the long run. What I'm going to get into now is the APTA's Code of Ethics. Now, the APTA's Code of Ethics is the professional standard for any physical therapist. What I'm going to do is I'm going to share these on the screen as I go through them so you can follow along with me. Principle 1 of the APTA's Code of Ethics. Physical therapists shall respect the inherent dignity and rights of all individuals. You not telling somebody that they may come in contact with COVID at your clinic is violating principle number 1. Principle number 2, physical therapists shall be trustworthy and compassionate in addressing the rights and needs of patients and clients. If you are putting profit over your patient's health, how are you being trustworthy? Principle number 3, physical therapists shall be accountable for making sound professional judgments. Principle 4, physical therapists shall demonstrate integrity in their relationships with patients and clients, families, colleagues, students, research participants, other healthcare providers, employers, payers, and the public. Principle 5, physical therapists shall fulfill their legal and professional obligations. Remember, you are violating public health laws right now if you are being somebody that's being shady about COVID. We've already seen many outbreaks at ATI and other clinics, and it's because they don't follow standard precautions. Principle number 6, physical therapists shall enhance their expertise through the lifelong acquisition and refinement of knowledge, skills, abilities, and professional behaviors. Just because you've been doing something for 30 years and you think that wearing a mask makes you less personable, I'm sorry, that's not how a contagion works. That's not going to stop the spread of a virus. Continuing competence. Principle number 7, physical therapists shall promote organizational behaviors and business practices that benefit patients and clients and society. How are you benefiting society during a pandemic? By being untrustworthy towards your patients and your staff. Principle number 8, physical therapists shall participate in efforts to meet the health needs of people locally, nationally, or globally. So think about your decisions, think about what you're doing. If you're not disclosing to patients, they may or may not be exposed to COVID by coming and seeing you. You're violating all the ethical codes here, and I hope your license gets taken away from you. Now, we know poor infection control has been going on in therapy for a long time. We've seen it amplified with COVID. We've also seen the shit of therapy amplified with COVID. If you don't think that you're going to be held accountable, you are wrong. I advise everyone, especially if you are staff at one of these clinics, to start documenting now. Contact your state labor board if there's any changes in your pay without your discretion. Now, in some states, they can take away PTO and benefits and reduce pay, especially during times of a financial crisis. But there are some exceptions to that. Sometimes they can't do it depending on your state unless they give you writing first and you consent to it. They also usually have to pay you your earned PTO. And I recommend that if you feel that you're not being treated fairly, you reach out to an employment attorney. So what are my credentials for this video? I know that there's some older PTs right now watching this being like, this guy's calling himself doctor. I've been a private practice owner 30 plus years. I'm not changing my ways. Nobody's got sick yet. The usual stuff. I hold a doctorate in physical therapy, a bachelor's degree in biology, a master's degree in public health, and I'm currently in law school studying healthcare compliance and healthcare regulation. And if you don't take care of this now, a few years from now, I guarantee you I will be providing resources for people to come after you. All right, guys, I'm Dr. Smith, physical therapist. Please subscribe to the channel. Please like and share this video. See you guys in the next video.